We're going to speak now a little bit about austerity policy and the consequences it may have on flesh and blood people. Currently in Europe, the tendency in general of all the economies is to demand austerity from governments. Even though we may be still immersed in the economic crisis, the idea is to create economic stimulus in order to reduce the public deficit and diminish the cost to the public purse. The governments, at the beginning of the financial crisis, decided, almost all of them, in unison, put forward certain economic stimulus programs as they become known. The idea was to stimulate the economy through public spending, and this led to states going into debt perhaps more than was allowed previously, at least when it comes to the European Union. This seemed to be the most plausible option in order to avoid the bloodletting of employment that was being seen, above all, in countries such as Spain, where the real estate bubble bursted. In Spain, we've seen a new phenomenon of unemployment, the literal destruction of jobs, and this has been exasperated due to credit not flowing well to the point that neither businesses nor individuals can access credit. Banks are not lending and participating in the quote-unquote real economy. Spain was considering a package, just like other countries, of incentives, which was known as stimulus. However, at the beginning of the financial crisis of the markets, especially sovereign debt, above all in the case of Greece, this trend was started where we changed the course in order to accelerate the fiscal consolidation. In the case of Spain, the European partners arrived essentially one day to the next over the weekend. Especially if I remember correctly, unfortunately, the Minister of the Economy, Spain was forced to improvise from one moment to the next and initiate a budget that embraced considerable cutbacks. And they presented a plan, the Spanish government did, where the public servants' pay was reduced from between 7 to 15%, and also, as well, there was a freezing of pensions. All of this obviously was not popular and cost the government to fall in public opinion polls. However, it seemed to be unavoidable given the pressure from the European partners. In the case of Spain, this induced a reduction of the expectation level of how the economy will grow because of so much public investment vis-a-vis the levels of unemployment, added to the cutbacks, not only in the public sector, but in public essential services as well. So one could ask themselves, what happens if you engage in cutbacks in education or in public health? When cuts are done in education, in all likelihood, our young people are going to be not as bright, in all likelihood, probably less prepared in order to deal with the realities that are are to come in the future. And of course, this, at the end of the day, is paid for by a lack of competitiveness, a lack of innovation. And if we mention also what happens if we cut back with public health, I could tell you that I've seen it in my mother's face, for example, because my mother recently suffered a fall where she had quite a serious pain in the neck, and she had to suffer the deficiencies of the public health Spanish system. In this case, specifically the hospitals in Tenerife. In the emergency wards that were completely overwhelmed with patients, they barely did an X-ray for her since they've been given instructions not to do any scans, and the scan would have detected the fracture. My mother went home in a lot of pain. Afterwards, of course, she wasn't able to overcome this pain, so she had to access a private clinic, which is where they found the fracture. Of course, she was then stabilized, immobilized, and taken to the public hospital where a surgery had to be done. And again, the lack of resources was quite evident, specifically with HR, lack of medics, lack of nurses, lack of staff. And this seems to be something that the patients are having to deal with. In my mother's case, she fell out of her bed because they had forgotten to put up the barriers on her bed. So this caused serious bruising on her leg, not fatal, but at the end of the day, she was able to overcome her injuries, and I really have nothing but gratitude to express for the doctors who operated her. That being said, I really have nothing else to say, but I regret the state that healthcare is at in Spain currently, and that these cutbacks are being having to be dealt with by the patients. The patients have to pick up the liability. Meanwhile, here in Belgium, in Brussels, people pat themselves on the back, the politicians, due to their bravery, in order to make hard decisions, hard cuts, but what they should really understand that those cuts, those decisions are really being picked up by people of flesh and blood, real people. And in the case that I'm speaking about right now is there's bruises, and they may not actually get around to helping you and fix those fractures that you have. I think that what's lacking is a little bit more humanity, because if not, unfortunately, the confidence of the citizens in the European project might simply disappear. Why don't we think a little bit more about these things and maybe come up with a new political direction for Europe? Thank you very much.